Welcome, everyone. My name is Melanie McGacken, and on behalf of the Rutgers Community Living Education Project team, I am excited to welcome you to Successful Transitions, a webinar series for students with intellectual and/or developmental disabilities, caregivers, and professionals. The Rutgers Community Living Education Project, also known as CLEP, is a program through the Rutgers School of Public Health and supported through the New Jersey Division of Developmental Disabilities, also known as DDD. The CLEP team can serve as a bridge for self-advocates and families whose loved ones are ready to explore various community living options. CLEP is committed to taking a person-centered approach when providing community living resources to people with intellectual and developmental disabilities. The CLEP team's contacts will be shared at the end of today's webinar. Before we get started, let's go over how you can best participate in today's learning event. Closed caption has been activated for today's webinar. To access or hide the closed caption feature, please use the Zoom toolbar on your screen. To ensure the highest sound quality possible, all attendees will be muted during today's presentation. We do, however, like to keep these sessions interactive, so to ask a question to the presenter or the host, please use the Q&A option on your screen. Topic-specific questions will be addressed if time allows, and for consideration to all of our attendees, we encourage you to keep your questions as general as possible. At this time, it's my pleasure to introduce today's guest speakers, Dr. Delia Cicada and Ms. Heather Van Campbell, both joining us from the Behavior Analyst Unit resource team of the Office of Risk Management at the New Jersey Division of Developmental Disabilities. Today's topic, preparing students for life after graduation, a behavior analytic perspective, is the final session of a two-part series. Without further ado, please join me in welcoming today's presenters as they share their insight on preparing students for life after graduation. Dr. Cicada, welcome.
Thank you so much, Melanie, for that introduction. Well, thank you everybody for joining us today for this presentation on successful transitions. My name, like Melanie said, is Dr. Delia Cicada, and I am a behavior analyst with the resource team here at DDD. I have a lot of experience working with adults with intellectual and developmental disabilities. I've been certified for about 20 years and have 23 years experience in the field. And this is my colleague, Heather, who is also in the team, and I'll let her speak for herself.
Hi, my name is Heather Van Campbell. I've been a BCBA about 5 years now, but I have about 16 years experience working in the field. I've worked with ages as young as 5 and up to 75.
Excellent. And a little bit more about us. What we do at DDD is that we are part of the resource team, and we provide not only training for caregivers and providers of support for adults with intellectual and developmental disabilities, but also we provide consultations for individuals that already have behavior support and require a little more assistance from their behavior team. So we get referrals when needed. All right, so that was a little bit about us. So let's go ahead and get started with the presentation.
If you attended last week's presentation with the fabulous Nkechi, you may notice some of the topics are a continuation, but our goal will be to be more in-depth focused on behaviors. For today's learning objectives, we will be addressing subjects related to transitioning from educational supports to adult supports, focusing on using behavior supports for teaching skill sets needed for adulthood, and understanding that behaviors are everything we do, not just what we consider challenging behaviors.
All right, so a little bit about behavior analysis, since that is the focus of what we do as behavior analysts. And it's easiest description for me to give everyone. Behavior analysis is essentially the detailed science of learning. We look at how individuals learn across many areas, not just the world of intellectual and developmental disabilities, but any wherever humans behave. And so we look at using a wide variety of strategies to support individuals. We use the learning theory to create individualized plans for individuals that need skill set development or challenging behavior reduction. And we use data always to drive our behavior supports, right? We want to make sure that we're collecting enough information to determine whether interventions are appropriate or not appropriate. How do behavior analysts support teaching and skill development? Well, we assess current levels of behavior. We look at breaking down skill sets that are important to teach into task analyses or small steps of instruction. We also look to identify functional and individualized reinforcers. So you'll notice a pattern. We always mention individualized supports because we are looking specifically at the person we're supporting. We also promote the use of data throughout, again, to look at the criteria, whether goals are being met, whether interventions need to be changed based on progress or lack thereof. And we also look to train staff and caregivers to monitor how plans are implemented, what skill sets are being reinforced, maintained, and how challenging behaviors are reduced.
While there are a lot of things to consider when creating transition plans during adolescence, there are a few things that should be in the forefront of planning: education and its role in the future, work or vocational aspirations, whether they are volunteer or paid vocations, future living. If it's not going to be remaining in their current setting, what does their future home look like? Independent, supervised, or group home living? Maintaining current relationships and engaging social interactions that could lead to future relationships. And being involved in the community, whether as a regular citizen or engaging in continuous and meaningful activities. Things to consider are both short-term and long-term goals, using the short-term goals to build or shape skills to lead up to those long-term goals or those desired end results. When considering these goals, we want to look at their current strengths, abilities, and interests, as those factors will help us make goals not only obtainable, but motivating to the individual. Factoring in their needs, whether it's social or emotional, and what that looks like for that specific individual. The goals need to be important to the person. Yes, we are always going to have goals that others think are priority and are needed, but this is where you can get creative, making them individualistic and motivating so the desired results and outcomes are meaning for each person. While transitioning will look different for everyone, and some of the things we discuss may not apply to everyone, it's also worth mentioning that there are some barriers that can make transitioning difficult. Opportunities to learn can be diminished when challenging behaviors dominate timeframes where learning is occurring. Relationships can be restricted by not only limited access to others, but struggling with making meaningful connections and building trust. Communication style vary from person to person, and family and caregivers tend to understand that communication most. Communication styles such as body language, limited verbal, or even limited signing may not always translate to others right away. So expanding communication to limit misunderstandings and frustrations that can lead to challenging behaviors should be considered. At times, goals can be developed that don't always include current skill sets. This could be because an assessment of skills hasn't been done frequent enough, or the understanding of the skills are limited. And if the individual is continuously not meeting their goals, this could become frustrating for them and the staff working for them. As we previously discussed, challenging behaviors can be a barrier to successful transition. Aggression can be in the form of verbal, making threats, or physical, touching another individual aggressively. Learning can't occur during these behaviors because the focus then becomes on de-escalation and safety. Refusing medications can not only have an immediate and long-term effect, but it limits their abilities for independence. If frequent refusals occur, then the potential for self-medication or limited supervision decreases. Refusing hygiene can not only lead to health concerns such as infections and illnesses, but possible limiting interactions with others and community engagement. Property disruption and destruction. We usually separate these two. Disruption is considered when the person moves items in the environment that can be considered disrupting, but not necessarily breaking the items. Destruction is more or less what it sounds like. This is actually breaking or destroying an object or area, like a window, wall, chair. When disruption occurs, this not only means the individual's environment, but could mean others' environment, which again, affecting social engagements, but could lead to disrupting those learning opportunities as well. Destruction can lead to not only financial concerns, as we know, home insurance doesn't always cover these things, but whose property is being destroyed? Can that be replaced? And how does it affect the environment for themselves and others? If they're in a situation where they destroy a bathroom and that's the only bathroom in the home, can they remain in a home with no working bathroom? Or how long is that bathroom going to be fixed? Take to be fixed? Elopement can be just leaving the treatment area, which again, we're limiting access to learning opportunities. But it also can be as big as leaving the home or the community, which can lead to a lot more dangerous scenarios. Self-injurious behaviors not only cause harm to the individual, but can lead to long-term damaging effects. For example, biting oneself may start by just leaving minimal marks or minor injuries, but could lead to severe scar tissue buildup and even reoccurring infections. Inappropriate social behavior. This is a little bit hard to define since there's not really necessarily a set of rules of engagement, and often some behaviors can seem as harmless. However, some things to consider is that the setting appropriate boundaries can help with social settings as well as avoid possible long-term legal troubles. What is considered harmless for a child may not be considered harmless for an adult. An example would be tickling, rubbing back or belly, sensory touches, and squeezes. Although there has been a lot of change with acceptance and awareness, we want to ensure safety. We're not asking individuals to conform to societal norms, but rather teach skills that promote safety and happiness while considering socially acceptable behaviors, especially at least until the others learn who they are. All behavior serves a purpose, which we are going to discuss in later slides.
All right. Speaking to the term socially appropriate behaviors or socially acceptable behaviors, it's absolutely something that we look at in the field of supporting individuals. What does this refer to? Well, it really refers to the behaviors that are deemed, behaviors and skill sets actually, that are deemed to be important for that individual. So like Heather said, it doesn't necessarily mean, abiding by society's rules, because society is not always going to be accepting of an individual, but it's truly making decisions in treatment and decisions in learning opportunities that are beneficial to that individual and meet their specific needs. So we always want to consider socially acceptable or socially appropriate behaviors that are individualized to the person.
Reducing challenging behaviors reduces barriers and can help improve access and maintain more relationships, help meet educational and pre-vocational goals, and increase opportunities for community engagement. We can also increase learning opportunities. We can continue to feel safe or be safe and improve their overall well-being.
Right. And in the world of adolescence, as Heather just mentioned, you have all of these concepts that you want to look at. And you also want to see them continue in the adult age. And we want to continue to reduce barriers and limitations to access. So you want to continue to strengthen skill sets that have been developed over time, and also teach new ones as new environments come into play, as a person's age changes, because that also might bring on new changes. And so, we put in here an example of a bolded specific area, right? In adolescence, we want to look at reducing challenging behaviors in order to promote learning. And in this case, an example of how it can differ a little bit, meeting educational goals and pre-vocational goals. In the adult age, we want to look at allowing for increased access, right, to something like meeting vocational goals. So you see the little changes that happen between adolescent and adult age expectations, and how we can look at increasing access, right? Increasing access to learning and increasing access in general to each individual.
As we've had before, all behaviors serve a purpose. So our goal would use function-based interventions. When we understand why these behaviors occur, we can better develop appropriate replacement skills that can be written into a behavior support plan to appropriately address the individual's needs and wants in a safe way. Functions usually include escape, access, attention, and automatic. When we consider replacement skills, we look back at these functions and determine what will work best for this specific individual. Functional communication training, or FCT, is an example of a function-based approach that teaches the individual to communicate their needs and wants more successfully than engaging in challenging behaviors. Some examples of FCT could be looking like making a request for a break instead of engaging in challenging behaviors to escape an undesired situation, requesting a preferred item instead of engaging in challenging behaviors to access that said item, engaging in appropriate conversation instead of engaging in challenging behaviors for attention, and requesting the use of a water table instead of engaging in challenging behaviors such as playing in the toilet to attain sensory input.
Mhm. And so the next thing that we look at is, how do we introduce learning opportunities that both look at teaching and reduction of challenging behaviors? And in some cases, that's going to be through a behavior support plan. So a behavior support plan is a document that should always be based off of a functional behavior assessment. We mentioned earlier that assessment is critical to what we do in the world of behavior supports. We want to assess behaviors, we want to assess skill sets, we want to assess changes over time. And so a functional behavior assessment will help us identify the reason of why behavior happens. And Heather mentioned the term function, right? Every behavior serves a purpose. So that means that every behavior has a function. So once we can determine the function, we can look at how to address interfering behaviors. We can look at how to teach skill sets that are beneficial to others, and we get the opportunity to measure behavior goals, right, through data. And so a behavior support plan can always assist with teaching new skills and assisting in reduction of challenging behaviors. And so the question then, do all individuals need a BSP? The simplest answer is not everybody is going to require a BSP. It's really going to be dependent on a person's skill sets, on their level of barriers that are in place, especially regarding challenging behaviors. The one thing that you will find is that all adult individuals that are receiving support will have an individualized support plan. And that is very similar to the individualized education plan. That ISP, or individualized support plan, should have all recommendations needed to support the individual and inform everybody that is a stakeholder in that individual's system of what is necessary to support that person. So at minimum, you have everything listed on an ISP, but if an individual requires more supports, then there might be a need for a behavior support plan. And so let's take a look at the behavior support plan in regards to safety and best practices. Well, the Division of Developmental Disabilities does have different circulars that inform us of different topics regarding supports of adults with intellectual and developmental disabilities. In the case of behavior support plans, which is the one area that we happen to be experts in, Division Circular 34 guides us on the different levels of behavioral interventions and also the different levels of approvals that are necessary to implement these plans. So I have here in a little diagram that is pulled directly from the circular, the types of levels of behavior supports that exist and also the required approvals for them. So you'll notice that there are 3 levels of behavior support plans. Level 1 is very minimal. It's mostly teaching strategies and reinforcement systems that are put in place. Usually just requires approvals from the planning team or the IDT, and it's at the discretion of the team to also suggest a medical certification, meaning ensuring that the strategies that are implemented do not put the person in physical risk, or also addressing medical clearance, right? Ensuring that the person the behaviors that are being addressed are not driven from a medical standpoint, and therefore medical treatment might be necessary before behavior supports. Level 2 plans are a little bit more restrictive. They just involve low-level restrictions along with the teaching and reinforcement systems. Again, they should be approved by the planning team or IDT, but in this case, a member of that team has to have behavioral expertise, meaning a board-certified behavior analyst or a behavior specialist that is being supervised by a board-certified behavior analyst. And again, it's at the discretion of the team to request medical certification. Then you have level 3 behavior support plans that have the more restrictive components, and those are listed in Division Circular 34. They're very specific. We are to abide by those restrictions only and not step away beyond them. But this type of plan requires all the approvals possible, right? We have the IDT or planning team. We have the behavior management committee, which if the agency that is supporting the adult individual does not have their own behavior management committee, we have one at the state. I happen to be the chairperson for that committee, and we provide supports to agencies and walk them through the process of creating a really good, solid plan that will be effective for the individual or assist with changing if it's not effective. Also, all level 3 behavior support plans should get approvals from the Human Rights Committee. And again, if the agency doesn't have their own, we have one at the state that can review plans and provide recommendations or allow the use of the plan. Also, medical certification in this case is no longer an option. It is mandatory. Informed consent from the guardian or the individual, if they are their own guardian, must be obtained as well. And also approvals from the agency CEO or regional administrator. So we have here Division Circular 34, right? And I actually have included the link for that circular. Please note that it should be the 1999 version. There is one from 2010 that was released but rescinded. It was not an appropriate, it did not have all the accurate information needed, but the 1999 version is the one that we are currently using. And so it lists all the level plans, it lists all the information necessary to understand a little bit more of how we look at behavior support plans. So please feel free to take a look at it on your own time with the link. But I do list here everything that I spoke about in the previous slide. All right, and so now we're going to look at assessments.
So circling back to a little bit of the difference between adolescents and adults are sometimes the types of assessments. So assessments are not only going to help us determine current skill sets and possible barriers to developing those skill sets, but they can also help us identify if those targeted skills are improving. Some examples of the assessments that are used with adolescents you may be familiar with. These are the assessment of basic language and learning skills, which is ABLS, Adaptive Behavior Assessment System, the ABAS-3, and very popular one is the Verbal Behavior Milestones Assessment and Placement Program, also known as the VB-MAP, which also comes with a VB-MAP barriers, which again, I mentioned previously, helps us identify possible barriers to developing skill sets.
And we see the transition over to adults where we still want to maintain the same goals of developing plans to continue to strengthen, maintain, and teach new skills as necessary. And we also assess individuals in this realm of functioning. And we have different assessments that can be used, such as the AFLS, or Assessment of Functional Living Skills, and the EFL, which are Essentials for Living. So we start looking at skill sets that are more appropriate to the age group, to needs that exist within the adult population. And so we can make recommendations for treatment, for teaching, and for targeting skills to develop and strengthen as well.
Certain life skills might look a little bit different for adolescents than they do for adults. Usually for adolescents, we're just starting to develop these skills. So when we look at safety skills, we're looking at, can they identify an emergency? This not only helps make sure that they respond appropriately, but that they can gain access to necessary services. We also look at, are they aware of their surroundings in their community? Again, this is so that they can gain access to necessary services. When we talk about meal prep, is how we kind of identify what appliances or utensils are not only appropriate for use, but can be used safely. We want to make sure that they are not only having the ability to choose what they're making, but also we want to make sure that they have healthy meal choices as well. Hygiene skills, usually we start these in the adolescent, like I think right 9, 10 for a lot of some of the bigger, like, deodorant and things like that. But we want to make sure that they not only help reduce the risk of illness and infection, but that they know that these can increase their level of independence. Homekeeping skills, again, we're going to help with their independence, but also help with keeping home in a safe living condition. And self-medication. This looks different for everybody. This can be like swallowing a medication on their own, using a pill dispenser to take their medication, or even just identifying when to take medications. And then we're going to start those pre-vocational skills that are going to help prepare them for possible employment if that's their end goal.
And as Heather said, all of these were going to look very different depending on the individual, their abilities and their capacities. So we can still target different goals that are beneficial for each individual, whether the person might be able to live independently or might need a high level of supports throughout their life. We can still target different skill sets to develop as best as the person is able to or capable of. So we look at the adult age group and almost all the same goals apply as adolescents. But we also, again, a slightly stronger focus on pre-vocational or vocational skills if that is something that is possible for the individual, because we look at working, in the adult group. But otherwise, all the goals pretty much remain the same, and we continue to maintain and strengthen skill sets as needed. Later on, we'll also talk about the different locations for residence, for living conditions. And so that also might add variables of teaching opportunities for these daily living skills.
Social skills tend to look a little bit different as well. We're going to be looking to have the individual ask for help and building relationships with others. Self-identity is a big thing that starts around adolescent ages, learning oneself, learning who they are, who they want to be, but again, keeping safety as a factor. They're going to start identifying interests that are meaningful to them and being able to make meaningful choices throughout their day. And then we also want to try to set them up for success by teaching coping skills. This will help them tolerate changes that aren't always avoidable. As they get older, life in general, there's a lot of things that we can't avoid, and we need to be able to manage those coping skills to be able to have successful transitions.
And with the adult population, we look at also, again, very similar goals, just continuing to strengthen them and maintain them. So those communication skills continue to strengthen and maintain, especially in different environments that adults experience, whether a person goes to a day program or work or a university program. There's different opportunities to develop skill sets that are specific to each environment. In the realm of self-identity and self-advocacy, that becomes extremely important, especially since the person now gains a whole new set of rights. They're able to participate in their planning team or IDT. And I don't know that I mentioned this earlier, but IDT is interdisciplinary team. So interdisciplinary team or planning team, they're the same thing. They can also participate in Human Rights Committee if there's a need to have some restrictions for their safety. So they can participate there. And again, in working on those coping skills as well, self-determination becomes a critical component of that adult, that change into the adult age. And so again, strengthening, maintaining, and continuing to teach is going to be critical in this realm.
So again, we're going to talk about the difference between developing leisure skills. We're going to refer to an assessment called the preference assessment. This can be helpful to identify possible preferred items and activities for each individual, which can guide in our choices and their choices. We want to try to expose new activities to everyone. We can't, you don't know you like something until you try it. So why not try these different outings, community outings, different activities? And then there's also broadening current interests. I once worked with an individual who throughout his childhood really loved cats, but was unable to have one as a pet. So that focus turned into a semi-problematic incident when he went to purchase 5 cans of sardines so he could leave them outside and try to catch a cat. We realized this was something that was very important to him. So we wanted to work on developing skills that he could developing skills that he could volunteer at a local animal shelter. This way, he was still able to get that interaction with cats, but it was in a safer setting. And then we want to teach participation skills for those meaningful activities. Again, we need to make sure that the individual's abilities and capacities are in mind as we work to teach pivotal skills that could develop successful engagement within their community.
Right. And again, with the adult population, we look at the exact same goals, especially when you add new variables, new access to activities that are, in the adult age group as well. So, for example, seeing a rated R movie, right? Somebody might want to watch a movie that's a little violent. Well, we want to assess, make sure that it's not going to be problematic, make sure that they're okay with going to the movie theater. Just little examples of that nature, that things that you want to do to broaden somebody's experience, not just leaving them with the few skill sets that they bring from childhood. We want to try to broaden as much as possible. And again, always taking into consideration the person's abilities and capacities, as Heather mentioned. And so we look at next how to teach and develop relationship building.
So one of the things with adolescents we start off with is discrimination training. This is teaching someone to tell the difference between things based on a certain criteria. This can help individuals with safety, developing relationships, and learning specific skills for different environments. When teaching social skills, we want to make sure that they are important to the individual. Do they want to engage with others, or do they prefer to spend time on their own? And on the other side of that, identifying their own personal space as well as others. Developing a form of self-advocacy skills. This is going to look different for each individual, but an example of someone who can vocalize could be storytelling. Can they recap a situation that happened and give their side of the story? A way I work this skill set in with some of the individuals I work with is having them watch a video and then having them tell me what happened in the beginning, middle, and end. This helps developing skill sets of them being able to put a sequence of events in order. For others that may not be able to verbally communicate, really focusing on those physical cues can still give an indication and a form of self-advocacy.
Absolutely. And then this continues on to the adult population, again, by continuing to maintain and strengthen those skill sets, and also addressing how those skill sets can be generalized to different environments that now the person encounters. So things like making friendships at a day program, or work colleagues. If the person is able to work and attend a vocational program or works out in the community, they're going to be able to, make acquaintances and even friendships if we have those skill sets in place, if we continue to work on those skill sets. And of course, with the age group comes also the possibility of romantic relationships, as long as the person is able to safely consent and assent to that. And some folks might be a little worried about that arena of, romantic relationships, but it's something that a person can have a right to, right? Again, if they're able to consent safely. We also want to look at developing awareness of laws in the legal system. Heather earlier made brief mention of, some behaviors that might be okay in childhood may not be okay in the adult world. And so we want to teach some of these skill sets that can keep a person safe as well, to avoid issues that lead to criminal consequences. I worked with a gentleman at one point, used to pull hair of individuals in the community. If he saw a long ponytail, he went and he pulled it and he enjoyed the reaction he was getting, which was usually, ow, that really hurts. And that put him at risk, right? That put him at risk. And so we were teaching him, if you want to talk to someone, please tap their shoulders, right? Tap a shoulder instead of pulling that hair, because you never know when somebody is going to say this is assault. And now the person has some more issues to contend with. We also want to maintain self-advocacy skills in regards to choices. Choice making is important. So relationships, honoring an individual's requests and needs of their choices, right? We want to make sure we abide by that.
When we look at the level of support, we want to try to encourage as much independence as possible. But we always have to remember that independence looks different for everybody. And it tends to be based on abilities, biology, environment, learning history, and at times preference. We can't always expect people to do toothbrushing if they can't hold the toothbrush, they can't squeeze the tube. We have to look at things. And then also preference. They might not like mint toothpaste. Maybe they need a more milder flavor. So we have to keep these kind of factors in mind.
On a side note, I like cinnamon toothpaste. That's funny and weird. But I have to compromise with my partner for mint. But in any case, all joking aside, yes, we also want to look at that and continue to maintain that thread in the adult population. We want to, maintain those skill sets that are learned in adolescence, continue to strengthen them, and continue to identify skills to teach as needed. In the adult world, you're encountering, like I said earlier, new environments, new people, new possibilities. And so we want to base our teaching and our instruction on that, right? And if a person also develops challenging behaviors at this time, we also want to address them as well. And it's all going to be based on a very individualized level of support, abilities, capacities, biology, all the variables that Heather mentioned apply in this realm as well.
So most school settings have a strong focus on targeting academics, but at times we have to consider, what does that mean to the individual and what is their end goal? What academic skill sets are going to prepare them for their future? Will they need skill sets for college, or are those skill sets maybe need to be tailored more towards an employment setting? Then trying to generalize those skills so that they can continue to pursue adult level activities like vocational and recreational skills. Some of the things we see in the academic world, math, for example, if they go into a vocational setting, math may be appropriate. Geometry still could be appropriate, but we need to look at that and see really how meaningful is that going to be that for them in the future. I also just want to have everyone keep in mind that the level of support in school setting can often look different. The 1-to-1 or 2-to-1 ratio for support staff and individuals is very common in schools, but unfortunately, we don't tend to see that in most adult settings.
Right. And in the adult settings, all of this is going to look a little different, right? The opportunities for daytime supports and community support will change. You have different opportunities that are available to the person, depending on their needs, depending on their abilities and capacities. So you may have the option of attending day program where staff can assist in identifying skills to teach and practice. A day program can benefit in teaching skills to participate in activities with peers and staff. It could also provide opportunities to create relationships with others, friendships, socialization. You can also have self-directed activities where everything is based out of like central point, the home, and the person can access different activities from that place. You also might have the possibility of specialized college programs. There's quite a few community colleges around the state that offer some very specific programs for individuals with intellectual and developmental disabilities, programs that are tailored to education for that group. And of course, you also have the option for vocational supports. Again, based on a person's abilities and capacities, that might look very different. You may have job coaching, you may have sheltered employment. I always think back to a particular individual I worked with when I first started in the field. We'll use his nickname, it was Buddy. Buddy could communicate verbally a little bit, not a very strong communicator, but he had an amazing affinity for U-Haul, the company, the brand. And so whenever we were out in the community, he would point out U-Haul trucks and say U-Haul. And if he was standing, he would absolutely show us that the U-Haul trucks backed up by beeping. And so he would say beep. And it was really sweet and really fun to see him be so passionate about this brand. Well, one day, the director of it was an intensive behavioral day program, said, I think we can get Buddy a job at U-Haul. And most of us who were very, very early in our career and very young, we just looked at her and thought, okay. Sure. We didn't know what to make of that, but she actually went over to one of the U-Haul locations. And she, it was a great learning opportunity for myself to have somebody that strong-minded, teaching us. She spoke to the manager there and told her about the location we worked at and who we were serving. And she said, do you have a job for this individual? Do you have something he can do? And he said, you know what, actually, the platform where all the trucks back up usually is pretty dirty. We can use someone to sweep it. And she said, great, excellent. You have now a new employee. So what she did is at the day program, we created a list of skill sets needed to sweep. We purchased a big industrial sized broom and we taught Buddy how to sweep an area with that giant broom. And he had a job. He was able to go 3 times a week to U-Haul and sweep this platform for about 30 minutes. It wasn't something really intensive. That's what he could tolerate. But he earned a little bit of a paycheck, making him a little bit more independent in that sense, because now he had a little bit more money to spend and use for his personal goods and things that he liked. And he loved it. He got a t-shirt on the first day, a cap, and he showed it all off to all of us. On the next day, he came back to us at the day program, and he was excited. It was part of his day to go to U-Haul and work, right? And all the gentlemen that worked at U-Haul really enjoyed his company as well because he was a fun guy. And so you can see that, right? You can dream big for people that you are helping to support. And again, considering abilities and capacities matters, but also seeing possibility for potential as well. What can the person do based on their abilities and capacities? So we want to think about that. And so the work opportunities for adults, right? Usually, historically, people with intellectual and developmental disabilities haven't had a great time in job scenarios. They've been either underemployed or unemployed. And if they are unemployed, they haven't been gainfully employed or paid well enough, right? A lot of times people are paid below the minimum wage. And so teaching new skills and thinking about working in a different light can start to change that historical pattern so we can be part of that change. In regards to the residential living arrangements in the adult world, that can also look very different than in childhood timeline, right? We might have different residential transitions. A person may move from their home to living independently, if that's a possibility with assistance. Somebody may move to a group home, right? If as parents get older, there's different things that have to be addressed, right, and looked at. Or the person may stay living at home. And so we want to look at all the skill sets that might be necessary to encourage appropriate transitions, good transitions, successful transitions. So we look at things like practicing moving skills or accepting changes, building reinforcement systems for new environment so that the person can feel comfortable in their home. We also want to maintain, Heather mentioned skills to maintain a home become really important. And that's going to look different, whether it's your bedroom in the group home or your apartment, or living at home with your parents, gaining new responsibilities as you turn to the adult age group. Teaching meal preparation or different skill sets around meal times, promoting participation in community events and activities, if you are living in a group home or a residential facility, teaching how to share spaces with others. That becomes very important. If any of you have had roommates like I did in college, that was a big transition, right? Moving from home to living with roommates. Sharing spaces was a big deal, especially I myself am an only child, so it was a very interesting transition for me to share spaces with my roommates. But you also get a chance to teach self-management skills, right? Teaching someone how to interact with others, how to, develop tolerance or, setting boundaries, all the things that we've been mentioning in all the previous slides. And of course, living at home, combination of all these skills might be needed to be arranged and taught or maintained and strengthened.
So professional supports are going to change, and that's going to be a huge adjustment. I know personally, I have had the same doctor for the past 10 years. I recently moved, and I'm still willing to drive that extra 20 minutes just to stay with that doctor. Some of the changes that it looks like are they're going to go from that pediatrician to that primary care physician. That could be a hard change for someone that, like I said, has been with the same doctor for a long period of time. Then we're going to look at our psychological supports are going to look a little different. Usually we have in-school supports like guidance counselors and school psychologists. As adults, they're going to need to find their own providers, and those providers are going to have to accept their insurance. Behavior supports are also going to look a little different. In the school, we usually have behavior supports in place. There's also companies that work in the home. But with adult services, unfortunately, it's sometimes harder to access those services. And you mostly see them in day programs or specific supervised home settings. IEPs turn into ISPs, individual support planning tool, which Delia had mentioned earlier. This should include as much information about the individual as possible. When I say as much information as possible, I like to use the example that an ISP should include and have as much detail that if that person were to be moved in an emergency situation, wherever they go, someone unfamiliar with them can still provide adequate supports and keep them safe. Occupational therapy, physical therapy, speech therapy, again, these are usually things that can be provided in the school and home, but they look a little different in the adult settings and, again, may depend on health insurance. And then an individual who's looking to continue their educational journey. This support will look different if it's in a college setting. And then those that are not continuing education could be looking at a vocational day program setting. These things are drastically different than a classroom setting that they're commonly used to and usually in for an extended period of time versus maybe college, which might not have as many supports, or a vocational and day program like Delia mentioned.
Right. And also something to think about in regards to the day program or vocational is that's only a short amount of time during the day. And so you want to look at building up the rest of the day, the schedule of the person's day to maintain an enriched environment and activities that are meaningful to the person. And so we understand, right? The first thing we know is this transition is not easy. It can be difficult, but it's important to start thinking about these changes, before somebody reaches the adult age. And if I remember correctly from Nkechi's presentation last week, she mentioned that it starts around the teenage years, maybe 14 or so, as per the IEP guidelines. So that's something to look for, right? That's something to ask if you are supporting someone in the adolescent age. Start looking at those changes. Start looking at what the transition will look like, what skill sets might be beneficial for them. And so if available, sometimes behavior supports can assist with that, whether it's helping somebody with the reduction of challenging behaviors, but also teaching those appropriate skill sets, those functional replacement behaviors that we always want to address, right? Ensuring that the person learns these skills. And so we look to improve quality of life in general with behavior supports. Again, if they are necessary for the person, if they are beneficial and available.
There are several federal and state laws in place to not only protect the individual's rights, but to promote self-advocacy and individualism. These protections also provide guidelines that are expected of those providing support so that an individual rights are not hindered in any way. An example would be the Division of Developmental Disabilities Participant Statement of Rights and Responsibilities. Wow, that's a mouthful. This is something that each participant or guardian signs when beginning services. This is a two-page document, so we're just going to touch up on some of the highlights that we think are important, such as privacy and to be treated with dignity and respect, protection from physical, verbal, psychological, and sexual abuse, neglect, or punishment, living and receiving services supports in the least restrictive environment, and to be free of restraint, and decide how to choose my services or to have someone I choose help me with decisions within the guidelines of the waiver program. And I believe we're going to be sharing this document so that you guys can see both sides of it. This is a very important document to read and know what an individual has rights to, and to also make sure that they can maintain those rights. If you ever see those rights being violated, you know, okay, nope, this is not okay. This is their rights, and you can speak up.
Absolutely. And one thing that you'll find is that, especially for us in the behavior analysis world, is that this is a continuation for us as well. We have a strong, lean towards the importance of balance between choice and rights. How we support someone, it's really going to be dependent on their voluntariness, whether they want to receive the supports or not. We want to look at the rights of the individual. And so I have a little screenshot and a lovely image next to that of a foundational article that we often have to read as during our education to really get a sense for that, especially all of us working with the adult population. And the article is from 1990, but it's, the title is Balancing the Right to Habilitation with the Right to Personal Liberties, the right of people with developmental disabilities to eat too many donuts and take a nap. Now, does it mean that you're only going to eat donuts? No. Does it mean that you're always going to just take naps? No, not necessarily, but it means that you have the right to choose to do that if you really want to. And so we look at teaching opportunities, right? Teaching how to make choices. What is available to you? And so I have the lovely image of somebody with holding a donut, but also being offered an apple, right? That is kind of the idea behind all of this, to provide the best supports that we can while still respecting the person's rights and their wishes. And so it's that balance that we must find. And one of the other things that you'll find is, especially if you're receiving supports from a behavior analyst, we have a behavior analyst ethics code, and I have linked it as well in the presentation. So the code of ethics is right here. If you're receiving services, it would be very beneficial to read the code of ethics, but there are 4 foundational principles that really guide us as professionals. And it's 1, to always benefit others, maximize those benefits while doing no harm. We want to treat others with compassion and dignity and respect. You'll notice that there's overlap with the document from DDD on personal rights and responsibilities. We also want to behave with integrity to the science. We want to make sure that we are, we are aligned with community goals, aligned with the society, aligned with the people that we serve, and we want to ensure our competence, meaning we always want to continue and further our education, not only through experience, but through continuing education. We want to make sure that we are competent behavior analysts to support individuals as best as we can. All right. And so in the realm of, how do caregivers, guardians, what is their role? What is their involvement in behavior supports? Well, the idea is in that transition, right? Transitioning to that adult is still going to, prompt the need of involvement. It's going to have you really realign expectations as they change from childhood to adulthood. We want to continue to promote teaching and development of skill sets, maintenance of skill sets, also looking at collaborating with the professionals involved, because parents, guardians, and caregivers are an immense source of information for us, and that can really help to drive good treatment, good techniques, right? And in that sense, we also want to make sure that as parents, guardians, and caregivers, that you have an active role in, applying all these strategies, continuing to also promote that teaching that I mentioned. And as far as guardianship goes, regardless of whether a person is their own guardian or they have a guardian, the idea behind behavior supports and guardianship is that we always want to make sure we obtain consent and assent to treatment. I mentioned the concept of voluntariness earlier. We want to make sure that you're willing to participate in this treatment, in the support of the individual. And the treatment is always intended to be individualized. If you are not seeing an individualized product, meaning the treatment, you should always talk to your behavior support specialist or your behavior analyst. See how we can individualize the supports further to make it more successful for the individual.
It's important to remember caregivers need support too. If the airplane safety videos have taught us anything, we have to put our mask on first before helping others. So sometimes that means we have to not only stick to plans that seem hard at first, but the end goal can reduce the stressors that we're experiencing. And not being afraid to ask for help, reaching out to other professionals for additional resources, or finding support groups that are available. A wonderful resource available is Mom to Mom Helpline, which provides confidential peer support from people who may be experiencing the same thing you are. CLEP is also an amazing resource in providing resources and connecting people.
And so in conclusion, the thing that we want to remember is behavior supports, when available, when appropriate for an individual, can be a great opportunity for improving somebody's quality of life, really teaching skills that are going to be beneficial to the person, make their life more enjoyable, make everybody else surrounding that person also have a better experience. And really the focus, I continue to stress this, and I cannot stress it enough, is the focus is on individualized teaching opportunities to the person based on their abilities, capacities, addressing challenging behaviors that are specific to them, that serve a function, and teaching and development of important skills that are going to be helpful to the person.
Both behavior supports and individualized teaching can reduce barriers and open the door for new opportunities to lead to successful outcomes. Again, we want to stress that behavior supports does not always mean challenging behaviors. As we've discussed throughout this video, it definitely can mean skill sets that the individual needs. Behavior is everything we do. And individualized, again, we always want to say it's got to be about the person. What is meaningful to them? What is going to help them? And you are your loved one's biggest fan, and at times their only voice. So please never be afraid to speak up for them.
We always use, very cliche term, the squeaky wheel gets the oil. So please never be afraid to speak up for the individual that you're supporting. The more you speak up, the more likely it is that people will listen and assist you in getting the supports necessary for your loved one or for the person you're supporting. So please, please, please always remember, advocate for yourself, advocate for the individual that you love or the individual you're supporting. This brings our presentation to an end. I want to thank everybody so much on behalf of myself and my colleague Heather. We do have a list of references that we have used for this presentation, and we also have our emails here. If you have any questions about this presentation, please feel free to email us. We're happy to respond to any questions about the presentation. And then I also have here the slides of all the contact information for the amazing folks at CLEP. And I want to thank everybody at CLEP for allowing us to collaborate on this presentation. So now I pass it on back to Melanie.
Delia, thank you so much. I greatly appreciate. Delia, can you confirm that you can hear me?
Yes.
Oh, perfect. Thank you. I apologize, everyone. Unfortunately, I was having some technical issues the last 5 minutes. I got bumped off. So I'm joining from my phone. So my apologies. Delia, Heather, cannot thank you both enough, again, for sharing your expertise with us today. We're getting some beautiful comments coming in from today's attendees. Delia, is it possible for you to open the Q&A section?
I sure can.
Again, my apologies.
Would you like me to field the questions?
If you could, that would be beautiful.
Okay, so we have a question here. At what age grade should the adolescent assessments be given, and would they be administered by school? How does this inform the IEP? So I'll let Heather tackle a little bit of this.
I guess this really kind of varies. Sometimes assessments can be given out as early as like age 2, 3. Sometimes they're done a little bit later, 9, 10. You know, that's a little bit hard. It's usually kind of if you notice they're not meeting their milestones and talking to your pediatrician and moving forward in that direction, having their advice in that case.
Right.
Sometimes schools can administer them, but that's usually if the school already has a behavior team in place. I do believe that some school districts are a little bit stronger with that support than others. And usually I think it's called the child study team that gets involved for those kind of assessments. And depending on the type of assessment, it does inform the IEP. It helps them identify the skill sets that they currently have or skill sets that they don't have for that age appropriateness that the assessment's determined for. Like I said, it's usually it's hard to determine when it's not a specific assessment that I'm speaking about, but you know, it's there's no limit is pretty much what I want to say. The age and grade don't factor in anything. It's more or less when you think that there's something that needs to be investigated further and reaching out to either your pediatrician or the schools.
And
Hopefully.
if I could actually add to that also, Heather,
Please.
if the individual is talking specifically about transition, we are, I, as a family member, really pushed for that to happen prior to the age of 14, but it can happen really no later than that school year that someone is turning 14 to start those conversations. The transition assessments really assist in collecting data specific to a student's needs, their interests, their preferences. It's all about that one student, and the data can really help plan for current supports or services around that person's interests and preferences, or for future, right? And when we talk about the future, we could be talking about many things such as work, education. Does that person desire to go to college? What does community living possibly look like for that person, and so much more? And then that data that's collected during those various transition assessments can really help define the goals and supports and services within a person's IEP. Specifically, you know, those transition assessments can help determine the student's goals and how to help meet those goals for that student.
Absolutely.
Yes, I
All right.
apologize. I missed the adolescent comment.
No, not at all. I know. I think what the information you shared is so important to be shared, because we have families and professionals of students of all ages on this session. So I think it was perfect.
Right. I have another question here. Does the behavioral unit team work with individuals in self-direction? So, for the resource team, like I mentioned earlier, we provide consultations to behavior teams that are already in place for individuals who might, that are receiving services through DDD. That only happens if the clinical team or the behavior team really can